Welcome to Tuesday's edition of COVID-19. Korea's daily tally is holding steady on the 400 level amid the launch of incentives starting today for those who have received at least the first dose of the COVID-19 vaccine. Now, we have more on this later on in the program. Here first is the broader pandemic coverage with our Kwon So-ah. Now, so let's begin here in Korea for this Tuesday.
Yes, Sunny, and let's begin with the vaccination updates for a change on this first day of June. With almost 5.8 million people having received at least one dose of a vaccine, that's 11.3% of the nation's population, and also 4.2% of the country's population has received their second shot. And the new month kicks off with good news for those who have been inoculated, as the government's first vaccine incentives take effect this Tuesday. So let's take a closer look. That includes an easing of restrictions on gatherings between immediate family members. 14 days after receiving at least one vaccine dose, people are exempt from the cap of 8 people. Also, personal visits to nursing homes or hospitals are allowed if one of either the visitor or the resident has been fully vaccinated. Senior welfare facilities will also reopen in June, and a number of public venues like parks and concert halls are offering discounts or free tickets. Further vaccination incentives will be implemented step by step, including eased masking rules in July. And now let's take a look at today's number of infections. 459 cases were reported on Tuesday as of 12 a.m. and that includes 449 domestic transmissions and 10 cases from abroad. So the total number of infections in the country stands at 140,799. And if we go over to the daily developments here, we've been in the 400s for the past 3 days, although we are seeing a slight uptick from Monday. And today's infections include 147 in the capital, Seoul, where there's been a new cluster infection linked to seniors at high schools, and that being a concern, of course, because seniors have to take the college entrance exam later this year. Also here, 116 infections in Gyeonggi-do province, including an outbreak at a singing room, and also a concern down in Daegu and Busan, which have 42 and 28 infections, respectively.
Right, so and staying on the local front, late Monday, the P4G Seoul Summit came to a close with participants there touching upon the pandemic as well.
Right, Sunny. On the second day of the two-day event, world leaders saw eye to eye on the need for international cooperation to overcome the climate crisis by learning lessons from the pandemic. So here's what President Moon Jae-in said through the Seoul Declaration, which was adopted on Monday.
정상들은 기후위기가 환경 문제만이 아니라 경제, 사회, 안보, 인권에 영향을 미치는 문제라는 데 동의하고 코로나19 역시 녹색 회복을 통해 극복해 나가야 한다는 데 인식을 같이 했습니다. 녹색 회복은 지구온도가 산업화...
Now, over at the UN Headquarters, World Health Organization Chief Tedros Adhanom Ghebreyesus called on the need for a pandemic treaty to strengthen the organization as well as global health security for better preparedness and response. And what the WHO also did is rename major variants. So if we take a closer look now here, the UK variant, the South African variant, the Brazilian variant, and the Indian variant, which are currently variants of concern, are going to be called the Alpha, Beta, Gamma, and Delta variants. And this to avoid stigmatization of countries. And this order is according to the order of detection. And let's move over to the figures abroad. We've got here the UK, which is seeing more than 3,000 new daily infections despite its fast vaccination process, and that due to the Indian variant. India, meanwhile, at 28.1 million cases, is seeing a decline in daily infections, although still at much more than 120,000. And the total number of cases around the world stands at 171.4 million. And those are the updates I have for now, but I'll see you back after the government briefing. Back to you, Sunny.
All right, so thank you for now. Right then, back on the local front, Korea's inoculation drive is picking up pace, with the U.S. offering Janssen vaccines to Korean Reserve Forces and Civil Defense Corps. For more on this, I have our Kim Ji-yeon here in the studio with me. Welcome, Ji-yeon.
Hello.
Right, I hear authorities have raised their first dose target.
Yes, South Korean health authorities say it's inching closer in its goal of achieving herd immunity by inoculating at least 70% of the population by November this year. And Korea is now aiming to inoculate 14 million people, or 27% of its population, with their first dose before the end of June, up from their previous target of 13 million. The country's vaccination drive is picking up pace with the arrival of Janssen vaccines from the U.S., following U.S. President Joe Biden's pledge to provide vaccines for Korean troops, following the meeting with President Moon Jae-in earlier this month.
Starting Tuesday, reservations will begin for more than 1 million doses of the Janssen vaccine provided by the U.S. following the South Korea-U.S. summit. In accordance with the agreement between the two countries, the vaccines are to be administered to military-related personnel.
The Janssen vaccines are scheduled to land in Seoul on a South Korean military aircraft this Saturday, and those eligible to receive the shots include reservists, civil defense personnel, and other workers affiliated with the military over the age of 30. And reservations for the Janssen vaccines will start Tuesday, with inoculations taking place between June 10th and the 20th.
Right, and that would be for those over the 30 and above. So what about those under 30?
Well, those under 30 are not eligible for the Janssen vaccines due to concerns over blood clots that have been linked to this particular vaccine in young people. Instead, the country's defense ministry says it's looking to hand out the Pfizer vaccine to people in this age group next week.
We plan to begin vaccinating those under the age of 30 next week, and we're looking at Pfizer vaccines as the most likely to be handed out.
It's estimated that around 414,000 troops in their 20s will be eligible for the vaccines next week. So far, some 117,000 service members in the South Korean military aged 30 and older have received at least one dose of the AstraZeneca vaccine since early May. And that figure represents around 88% of all service members who are eligible to receive the shots.
I see. And Chen, here's one final question before you go. I understand Moderna, our first shipment, that is, of Moderna vaccines has touched ground.
That's right. The first batch of Moderna vaccines, numbering 55,000 doses, is arriving in South Korea one day later than scheduled on Tuesday today, becoming the third COVID-19 vaccine to arrive in the country after those from AstraZeneca and Pfizer. Starting mid-June, they will be administered to medical workers under the age of 30 who have not been able to get vaccinated following the suspension of AstraZeneca shots for that age group. Also, another batch of 879,000 AstraZeneca doses are being released on Tuesday today as well, following a separate contract between the company and the South Korean government. So far, more than 5.4 million people in Korea have received COVID-19 vaccines, which account for around 10.5% of the country's population.
All right, Chen, as always, thank you very much for that coverage.
Thank you.
Right, up next, we're poised to join the regular briefing on the COVID-19 situation here in Korea for this Tuesday. Now, as mentioned earlier, starting today is the launch of incentives for those who have received at least the first dose of the COVID-19 vaccine and have witnessed the passing of 2 weeks. Now, first, these individuals are excluded from the cap of 8 people for family gatherings. This means any family member who has received at least one dose at least 2 weeks prior will be exempted from the head count of 8 people for family gatherings. Secondly, access to senior welfare and activity centres is allowed, and for those fully vaccinated, recreational programs such as singing classes is permitted, as is the sharing of meals. Also, in-person visits to nursing homes is possible if one party is fully vaccinated. However, at nursing homes where the vaccination rate for the first dose stands at below 75%, a negative PCR test will also be required. Now, prior reservations are necessary and no eating nor drinking is allowed during these face-to-face meetings at nursing homes, and masks remain mandatory. Moreover, those fully vaccinated and working at high-risk facilities such as nursing homes will be exempted also from the regular mandatory screening requirement, which reportedly takes place once or twice a week. Other incentives include entrance discounts or even fee waivers at concert halls and national parks. And come July, those who have been vaccinated will also be allowed to go mask-free. The briefing is about to start. We'll come back to you afterwards.
네, 방대본 역학조사 분석단장입니다. 6월 1일
Let us now begin our regular
코로나19
briefing
정례
for
브리핑
June
시작하도록
1st,
하겠습니다.
Tuesday.
먼저
First of
예방접종
all, on
현황
the vaccination
설명드리겠습니다.
front, here are some updates.
현재 예방접종센터에서 진행되고 있는
Right now at the vaccination
75세
centers,
이상
we are
어르신에
rolling
대한
out
접종은
vaccines for over
6월
75
13일까지
years of
1차
age,
접종을 완료하는
and
것을
we
목표로
aim
하고
to
있습니다.
finish our first dose inoculation by
2차
3rd
접종에
of
집중함과
June.
동시에
And later on, we will be
아스트라제네카
focusing
접종
on the second
대상에서
dose.
제외된
And as for the
30세
people who
미만
are exempted
2분기
from
접종
or
대상자에
who are not
대한
subject to the
접종을
AstraZeneca
시작합니다.
vaccines, they are those below the
사회필수
age
이력
of
등
30.
2분기 접종
And
대상자 중
also out of the
30세
Q2
미만의
eligible
신분에
recipients, especially
다음
those
주
who are
월요일,
below the
6월
age of 30, next week from next week at which is 7th of June, we will be providing the vaccine reservations at vaccination centers, and they will be getting the Pfizer vaccines.
다음은 예방접종
And next,
진행
as for
상황
the vaccination
설명드리겠습니다.
progress, here are some
어제 하루
updates as well.
41만
Yesterday
3천
alone,
명이
more than
예방접종을 받으셨습니다.
412,000 people have received their
38만
vaccinations.
6천 명으로
And out of them,
6월
the
1일
first dose
0시
recipient
기준으로
stands at about
우리나라 국민의
385,000.
총
And as of today midnight, we have
579만
more than
2,000
5.7 million people, or about 11.3% of the total population who
65세
have
이상
received
어르신 접종을
at least
시작한
one
5월
vaccine
17일부터
dose.
31일까지
And also, starting from the
53만
May
명의
7th
1차 접종이
until the
이루어지고
31st,
있습니다.
we are
국민들을 제외한
also
숫자입니다.
providing the vaccinations to about
60세 이상
570,000 people on a daily
아스트라제네카
basis,
1차 접종 예약률은
excluding the public
70%를
holidays
넘어서
as well as weekends. And right now, the booking for vaccination appointments for the elderly surpassed 70%, and it is about 73% right now. And we would like to take this opportunity to thank all of the public for your
사전
continued
예약을 하신
participation.
어르신들은 접종일이
And
되면
as for the seniors who have
예약한
already
의료기관을
made their
찾아서
vaccination appointment
예방접종을
bookings,
받아주시기
we
바랍니다.
ask you to visit the designated hospitals
다음은
on the day
얀센
of
백신
your vaccine
예방접종
appointment.
예약
And
상황에
as for the
대해서
vaccine, Janssen vaccine
말씀드리겠습니다.
appointments, here are
오늘
some
0시부터
details. So starting from
코로나19
midnight today,
예방접종
we have been
사전 예약
receiving the
시스템을 통해
bookings for the
얀센
Janssen
백신에 대한
vaccine
사전
rollouts.
예약도 진행하고 있습니다.
And this is also underway
오후
right
1시
now. And
기준
as of 1
64만
p.m., we
6천
have
명이
more than
예약을 완료하였습니다.
640,000 people who
도입
have
백신은
already
한
signed up
바이올당
for
5명
the
정도로
reservations.
예약 인원은
And
100만
one
명 미만이
vial
되더라도
of this
조기
shot
종료될 가능성이
can be
있습니다.
inoculated to
최종
about
배송량과
4 to 5
예약
people.
인원을 확인하여
And we will
100만
be
명분
looking
배송에
at
맞춰서
the
예약
exact
공고가
number of
진행될
these reservations,
예정입니다.
and we will complete this
다음은 백신 공급
booking
상황에
process
대해서
in
말씀드리겠습니다.
also calculation of the
모더나
exact
백신
number of doses that
55,000
we have
회분이
right now.
오늘
And
인천공항에
also
도착 예정이며
55,000 doses
총
of Moderna
4천만
vaccines are
회분의
set to
공급이
arrive in South
시작됩니다.
Korea, and we will also
개별
provide
계약된
more vaccines to the
아스트라제네카
public as
백신
well. And as for the
87만
AstraZeneca
9천
vaccines,
회분은
we also have
오늘 안동공장에서
879,000 doses, which will be shipped out
708만
from
회분이
the Andong
공급되었습니다.
factory. And right now, we
개별
already
계약된
also
화이자
have more
백신
to
65만
come.
회분도
And as
내일
for
인천공항에
the
도착해서
Pfizer vaccines,
총
we
440만
also
회분이
have
공급되며
about
계획대로
650,000 vaccines,
예방접종이
which will
진행될
arrive as
예정입니다.
well. And we also have in plan
다음으로
to
요양원 그리고 요양병원의 집단
be
발생에
supplied
대한
with more Pfizer
예방접종
vaccines going
효과를
forward. And as for
설명드리겠습니다.
the efficacy of
조사 분석
these
대상은
vaccination at nursing
아스트라제네카
hospitals and
백신
long-term
1회
care
접종 후에
centers, we have been
집단
looking
발생이
into
있었던
these
요양원,
studies,
요양병원
and we have
4개
been looking at
기관이고
4
이중 2개
hospitals
기관은
and long-term
영국형
care
변이가
centers,
발생한
and out of
기관입니다.
them, 2 hospitals and
1차
facilities
분석
had
결과
UK variants.
아스트라제네카 백신이
And our
영국형
primary
변이에서도
study shows that
90%
AstraZeneca
이상의
vaccine
감염 효과를
was effective
보였습니다.
in protecting and preventing the
말씀드린
infections of
내일
UK
시절이
variants
평균
as well by up to
90%
90%. So once again, it was
변이가
about
없었던
90%
두 개 기관에서
effective.
이 기관은
And also at 2 other
91.7%와
facilities
81.3%였으며
that had also no UK
영국형 변이가
variants,
있었던
the effectiveness of these
기관의
vaccine
효과는
was about
각각
96% and also 82%
이는 변이
respectively.
유무와
And
관계없이
this shows that regardless
모두
of
의미
the
있는
emergence
백신
of the
효과를 보인
COVID-19
것으로
variants, we
판단하고
see
있습니다.
that there has been very
다만 본
significant
분석은
and meaningful
단기간 내
implications
비교적 좀 작은
from
인원을
the
대상으로
efficacy
이루어진
of
것으로
these vaccines.
그 제한점이
However,
있습니다.
we also
그렇지만
have limitations
집단 발생
because
시설
the subject
생활자를
of the study was
시설
very
생활자를
limited.
대상으로
However,
증상
we
유무와
see
관계없이
that as for
검사하고
these
또
group
무증상한 감염자를 포함한
including the
예방
nursing hospitals and also long-term care centers. We have been looking at the efficacy of the vaccine, so we believe that this data in itself is very meaningful right now. And as for the long-term, as for the nightlife entertainment venues, that is, we are also analyzing some risk factors. And starting from January this week, we have also a total of 46 cluster infections, and more than 2,200 people have been infected stemming from these related facilities. And in Daegu City, we have seen one person who was a user of this nightlife entertainment venues, and this virus had spread to a total of 15 related facilities, and we have seen the infection spread to about 170 people, and this virus spread also spread to family members and so forth, infecting a total of 239. And in Yangsan City, we also have one user who has been infected with the virus and also spread the virus to a total of 7 cluster infections and a total of 27 people, which also spread the virus to a total of 40 people. Because these facilities are visited by many people, many people who are frequent visitors, we also say that there is high risk of virus infection. So please refrain from going to these facilities if you have any clinical symptoms. And also, if you visit these places, you need to comply with the face mask wearing rule and also get tested if you have clinical symptoms. And as for the new variants updates, here are some updates. The WHO has announced its measures to rename these variants using the Greek alphabets like Alpha, Beta, and so forth. And this also will be considered here in South Korea by the Korean health authorities, and we will be using these names as well, and they will be also used going forward and in phases. And in order to intensify our monitoring of these new variants, we are bolstering our monitoring and inspection. And during the past week, we have been looking at more than about 14.9%, threefold more than what the other countries do in terms of gene analysis. And we have confirmed that 202 additional new variant cases have been identified. And the Alpha, the UK variant, there were 170, and Beta, the South African variant, 8 cases, and Delta, the Indian variant, there were 24 cases. And out of these 202 additional cases, 32 were imported cases, while the rest were domestic infections, and these in Gyeonggi-do province there were 30, Jeonbuk also 20, and also about 20 people in Ulsan City as well. And since October last year, we have been seeing about 1,590 these new variants here in South Korea, and the South Korean variant, South African variant, that is, there were about 130, and also many other Indian variants, and also this Brazilian variant as well. And as for the Korean residents returning from India, we have had about 13 rounds of flights coming in from India, and we have had about 2,700 South Koreans return to Korea, and we also have a total of 56 confirmed cases, and among them 16 have been identified as new variants. And as for the MIS-C infections syndromes among the juveniles, we have seen the 5th case here in South Korea. And as for this syndrome, which has been spotted after April last year among the countries like the US and Europe, we have seen that these juveniles and kids, they have been contracted with the virus, and after several weeks, they have seen the inflammatory syndromes in many multi-systems within their bodies. And also, we have identified the fifth case here in South Korea. And we identified that this patient went through symptoms like high fever and diarrhea and so forth. And this patient has been also released from hospitalization after recovering. And we have been looking at this specific case, and we have seen that this was also a case of MIS-C that we have identified. And on a monthly basis, we are doing the public survey, and we see that there are many more people who are willing to get vaccinations, which also rose from 61% to about 69% on month. And we also identified that those who have already received their jabs, they comply with the quarantine measures even after inoculation, and they also encourage others also to get the jabs as well. And about 85% also expressed fears or nervousness about the side effects. However, unlike your nervousness and also anxiety, please note that these side effects are very rare. And if you are vaccinated, it is very important and effective in preventing the infection from spreading to your loved ones. So it is very important that we get ourselves vaccinated to return to a state of normalcy and to protect the health and safety of myself and also the members of my family. And also we need to mention that these vaccination and the quarantine measures need to go hand in hand. And in order to really overcome the COVID-19 pandemic, we need to stabilize and control the COVID-19 outbreaks here in South Korea through swift and safe vaccination. And we need to also at the same time carry out continued quarantine measures. Mask wearing and also regular ventilation and regular testing if you have any symptoms are also very crucial. The quarantine authorities will also exert our full efforts to carry out safe vaccination going forward. Thank you very much.
기자님들 질문에 답변 드리는 시간 갖겠습니다.
Right, that was Lee Sang-won with Tuesday's afternoon briefing, and I have our Kwon So-ah here at the desk with details of what he had to say. Right, So-ah?
Yes, Sonia, let's begin with an assessment of outbreaks of the COVID-19 virus at medical facilities such as nursing homes and nursing hospitals, which were some of the facilities prioritized in the vaccination program here in the country. And authorities have found that there were the UK variant, or I should say the Alpha variant, according to the renaming of the World Health Organization, that was found in 2 of 4 medical facilities that were analyzed. And the AstraZeneca vaccine was found to be around 90% effective also when it came to the UK variant. And also the official mentioned that there were 200 new variant cases detected in the past week, with 170 of those being the Alpha or UK variant, 8 the South African or Beta variant, 24 the Indian or the Delta variant. And with that, now we've got almost 1,600 variant cases here in the country. And meanwhile, the government also plans to complete the vaccination for seniors aged 75 and above by June 13th, of course. And we've just got 2 days left for the pre-registering for seniors. So that should also be noted.
All right, so thank you very much for that.
My pleasure.
Curtains went down on the P4G summit late Monday with the adoption of the Seoul Declaration that pledged global solidarity on green growth. Now, on the sidelines of that summit, a fashion show was held promoting waste reduction through fashion statements. For more on this, I have our Kim Sang-yeon here in the studio today. Sang-yeon, welcome.
Good afternoon.
Right, now walk us through this very meaningful event.
Right, Sunny. As you did mention just now, it was promoting waste reduction. The show paid homage to one of the P4G's 5 main areas of collaboration, which was indeed regarding climate change, namely the circular economy. The upcycling fashion show, as it was called, was organized by Korea's Ministry of the Environment, making use of waste materials to make bags, clothing, as well as other fashion accessories. While recycling requires materials to be broken down first, upcycling, or creative reuse, turns waste directly into a new product, resulting in goods that are of higher quality and that are much more energy efficient. Now, the world has seen a dramatic increase in the use of single-use plastics amid the COVID-19 pandemic, and upcycling is being looked to as one solution that could help us tackle the growing problem of plastic pollution. Now, there were a number of dignitaries on hand, including Korea's First Lady, the wives of foreign ambassadors, as well as business representatives and environmental activists, among others. However, attendance was limited to 100 people, and most certainly masking and social distancing rules were in effect in light of the risks posed by COVID-19. Nevertheless, there was no shortage of spectacles at the event, featuring many top models and a music performance by a folk fusion band named 이날치.
And Song-yeon, I understand the First Lady caught the attention of many there with a rather unique outfit.
Right, she was seen wearing a very beautiful and special hanbok. Sunny, First Lady Kim Jong-suk wore a traditional hanbok, and so did the wives of many foreign dignitaries who were also at this event. Not only did they look stunning, but their outfits also had eco-friendliness in mind, being made out of upcycled materials sourced from plastic waste. But you couldn't tell just by looking at them because they were just so natural. Moreover, the attendees wore face masks, which were specially designed to match their hanboks, also made from upcycled materials. This made it possible to successfully convey the value of resource recycling together with Korean traditional beauty.
Of course, and the show itself, Song-yeon, I understand, was held against the stunning backdrop of Gyeongbokgung Palace.
Right. I think the Gyeongbokgung Palace looked extra beautiful on Monday night. More specifically, the event was held at Gyeonghwaeru, a pavilion inside Gyeongbokgung Palace where kings of the Joseon dynasty used to hold large banquets centuries ago. Now, the theme of the fashion show was that of a sustainable future through the upcycling of waste, exploring elements from both the past and the present. Many clothing and other fashion items were on display, including shoes, bags, casual wear, sportswear, and hanbok. The show also features some of Korea's most iconic supermodels, including Song Kyung-ah and Han Hyun-min.
Now, I would have loved to have been there. Now, there's been some buzz, Song-yeon, over some of the items on display.
Right. The show was divided into 3 parts, Sunny. It was showcasing in part 1 casual everyday wear, part 2 sportswear, and part 3 hanbok, exactly in this order. Now, supermodel Song Kyung-ah was first to hit the runway, wearing a black jacket and long skirt. All in all, the runway models were wearing casual everyday outfits, including a shirt, jacket, or just a pair of jeans that didn't look out of the ordinary at first glance. But they were all made from materials sourced from plastic waste and scraps of fabric that had been disposed of, which is the reason why it made them very special. Now, part 2 of the event showcased athletic wear and clothing for workouts made from plastic waste. These already have a large presence in the apparel market, and they come with eco-friendly certifications depending on the amount of waste plastic that is used to make each of the items. Now, fusion hanboks were featured in part 3 of the show, which were made from leftover fabric that still had a particular signage on it of a well-known food company, for instance, as well as from canvas banners that had been reprocessed, but still retaining their original colors and patterns as well. And Korean actress Park Jin-hee and rapper Sean, they graced the final stage, each wearing a hanbok. Park Jin-hee's dark brown hanbok in particular was made using a combination of waste plastic and burlap bags that were once used to store coffee beans, which captured the imagination of the audience. This sort of transformation of waste was not only surprising, but beautiful, and the audience seemed to watch with admiration.
Right, so what changes are we expecting in the fashion industry moving forward?
Right, well, as I mentioned earlier, Sunny, COVID-19 certainly has triggered an immense surge in waste pollution. It's quite serious. In fact, the world is throwing away 15% more plastic compared to pre-pandemic levels, and the circular economy is an essential driver in our path towards a greener future. Now, organizers of the fashion show are hoping to raise public awareness on the importance of upcycling through events like these. Many players in the fashion industry are supportive of this transition, and the presence of many top fashion brands as well as models at this event is evidence of that. So we are expecting a growing number of upcycled products, not only in fashion, but also other industries. And this is one of the main goals that the P4G partners had underscored during their summit here in Seoul.
All right, Sang-yeon, thank you very much for the beautiful report.
The pleasure is mine.
우리 국민의 10% 이상이 예방접종을 받으셨습니다. 특히 80세 이상 고령층의 접종은 60%에 이르러 코로나19에 가장 취약하신 분들에 대한 보호체계가 더욱 두터워지고 있습니다.
(6월은) 집단 면역 달성으로 가는 여정에서 가장 큰 고비가 될 것입니다. 방역의 실천과 적극적인 백신 접종으로 7월에는 일상 회복에 한 걸음 더 다가가는 그런 일이 일어나기를 기대하고 준비하겠습니다.
Korea's daily tally has been on a decline in recent days, while efforts are underway to offer the first dose of the COVID-19 vaccine to 14 million people within this month. Also this month is the launch of vaccine incentives. For more on this, I have Professor Chung Gi-seok from Hallym University. Pleasure to have you again with us, Professor Chung.
Thank you for inviting me.
And I also have Professor Kim Moon-gyu from Yonsei University. Good to see you again, Professor Kim.
Thank you for having me.
Right, Professor Chung, as I mentioned at the start, our daily tally has been on a steady decline since mid-last week. What is your assessment of the local COVID-19 situation?
Yeah, I think the vaccination works. So, as we know, our recent daily occurrences has been reduced by 5% compared to last week's average. And the mortality is still high on average, 1.4%. But recently, the mortality is less than 1%. And the severe and very severe cases shows very stable. So all that statistics is because of in advance prevention in long-term care facilities, etc., but also due to vaccination program. Because we have, as of today, we have 11.3% of whole population has been vaccinated. And particularly those vaccines was distributed in very vulnerable people, like elderly people who are residents in long-term care facilities and etc. So it could prevent the occurring number, an increasing number and severity by COVID-19. So by the end of June, maybe 25% or more people could be injected, and then we will see another very stable daily tally by that time.
Right. Right, Professor Kim, as Professor Chung has just mentioned, the government is planning to inoculate 14 million people within this month, given the arrival, expected arrival that is, of Janssen vaccines from the US. How feasible is this plan?
First of all, I'm very glad that we have more choices which kind of vaccine we can take. And before we think of which kind, it's important to get it. I mean, whatever the kind. I mean, I wish that people do not waste time thinking about it, delaying time because they choose this one or that. By the end of April, the vaccine speed was slower, but now I believe that we can speed up because we have cold chain ready, medical facilities are ready. I do hope that everybody get vaccinated the first dose before Chuseok and finish the second shot by the November.
We'll keep our fingers crossed.
Yeah.
Professor Chung, do tell us a bit about the differences between the Moderna and Janssen vaccines and the Pfizer and AstraZeneca vaccines that are currently being administered here in the country.
Well, Moderna and Pfizer is a similar one. Both uses the mRNA vaccine. mRNA is a delivering method. All the purpose of recent vaccine is to make a spike protein or spike protein-like material. So mRNA makes the spike protein in both Moderna and Pfizer. But the Pfizer should be kept in -70 degrees, while the Moderna could be kept in -20 degrees. That's the difference. And another difference is the interval. The Pfizer is 3 weeks interval, the Moderna is a 4 weeks interval. The side effects, there are not side effects many reported, but mostly people are worrying about anaphylaxis because it contains polyethylene glycol, which can cause anaphylaxis in very sensitive people. So recently, but mRNA vaccines might cause myocarditis, but there is no evidence so far, but several myocarditis cases are being reported. By the way, the AstraZeneca and Janssen can be categorized in the similar category. So those are so-called virus vector vaccine. AstraZeneca uses a chimpanzee adenovirus, and Janssen uses adenovirus type 26, the similar type of adenovirus. So vaccine effectiveness is still similar, 67% or 70%, and it can prevent very severe and hospitalization over 90%. But as we know, both vaccines have some very rare adverse event, like thrombocytopenia and thrombotic syndrome, TTS, thrombocytopenia and death syndrome. So we have one case reported today, but it is a very rare one. Just 1 out of 3 million, over 3 million injected in this country. Usually the number is 10 out of 1 million in EU. And at the same time, the Janssen is also have a similar TTS event in about 2 to 3 out of 1 million. Or if it is a very vulnerable case, like young women under age 50, then you might see 7 or 8 cases per 1 million.
I see.
So those adenovirus vector vaccine have some very rare thrombocytopenic syndrome. But if you look at the risk of getting COVID-19 and the risk of you might die with COVID-19, then you have to choose the vaccine rather than avoiding the vaccine.
I see. Professor Kim, recent findings show that 7 out of 10 unvaccinated people are willing to get their vaccines now. Do you suppose the offer's incentives has played a part, perhaps, in rallying public support for COVID-19 vaccines?
I agree, and I hope this is true. As you told, survey tells that about 70% of Koreans are willing to get vaccinated, which is an increase in 7.8% compared to last month. And but we have to still remember that there are people out there reluctant to get vaccinated, and this portion might increase if unscientific and groundless rumor rules the internet. If I quote the Israeli doctor, Professor Sarile Cohen, he was on the program last time. He said that at the beginning of the Israeli vaccine program, 40% of the people were willing to get vaccinated, and 20 are still reluctant, and the rest were in between. So they started the incentive program of many kinds, and I think that played a role So we should not be too optimistic about this survey, and every effort should be made to motivate people, give incentives with maintaining certain level of vigilance.
Right. Professor Chang, you mentioned the cases of very, very rare blood clots with regard to the AstraZeneca and Janssen vaccines. What are some practical ways of perhaps responding to these post-inoculation adverse reactions?
Yeah, that is again a very rare case. Okay, so you don't have to much worry about it. But if you have a vaccine with the adenovirus platform, then you might see a very common side effects in a day or in 3 days, like pain in injection site, the fever and myalgia, and etc. Even though I got my own shot yesterday and I have no symptom so far. But the TTS begins 4 days after injection and until 28 days. So between 4 days after and until 28 days after injection, you might have headache, blurred vision, motor weakness, abdominal pain. All of these are because of a blood clot in the blood, in your blood vessel, in head or in abdomen. Or you may have edematous legs because of blood clot in the deep vein in your legs. So in that case, you have to suspect a very, very rare case, and you have to visit the hospital. Then once a doctor suspects that kind of disease, then the diagnostic criteria is there. So when you have a certain evidence of blood clot in any part of your body, and you have a platelet count less than 150,000, and also you have to have a platelet factor 4 antibody in the blood. So the worst case in our country have shown all the criteria. The case met the criteria in this case. So it's not very difficult to diagnose that. The treatment is also well established. You have to avoid heparin, and then you have to use new oral anticoagulants, and sometimes you need to have intravenous immunoglobulin, which is a very specific agent for the treatment of that kind of disease. So if you have a similar symptom in less than 3 days, that is not a rare blood clot. If you have a similar symptom after 28 days, that's not the case of TTS. So don't worry too much of it. It's a very rare, very, very rare case.
I see. Professor Kim, we talked about how mass inoculations are in the works this particular month. Do we host the necessary infrastructure for these mass inoculations?
Sure. Now we have reached about 11% of our population, and we are expecting half will get the first dose by the end of June, and this means every daily vaccine will reach 300,000. And we have enough if we have enough supply, and if people are willing, we have a system that the daily vaccination can reach even 1 million per day, theoretically. Public health centers are contacting from the elderly people to the younger, and they make sure that there are no leftovers of the vaccination, and they're looking for volunteers by SNS. And I think it's very effective right now. And also we have a good news that there's going to be more kinds of vaccines, as mentioned, Moderna, Novavax, and Janssen soon. So yeah, this will definitely boost the speed of vaccination in Korea.
Right. And on a slightly somber note, Professor Chung, how does the growing presence of variants here on the local front look to affect our inoculation drive, do you think?
Yeah, because the variants are made in our own body. It's not replicated in other space. So if you prevent the virus from the beginning by vaccination, then virus cannot come to my body, and there is no chance of being variated. So Still, most vaccines are effective in even the variant species. So even though not the 100%, but so the best way is to speed up the vaccination. And if 100% of our population is protected by a vaccination, then there is no way to for the virus to be variated in the body. So there is no mutation if you do not have a virus in your body. So speed up the vaccination and spread the vaccine in as many population as possible.
Right.
It's the best way.
And along with speeding up with the vaccinations, Professor Kim, what are your words for those who are recently vaccinated? Words of advice for those who are recently vaccinated?
Well, vaccination is not a perfect thing. So follow the instructions that was told by the medical personnel. And if you find something strange and if you don't know what it is, you should ask somebody. You can contact doctors or the hospital for any strange symptoms and make sure whether it's an early sign of complication, as Professor Chung mentioned, and keep yourself hydrated.
Right. All right, Professor Kim, thank you very much for your thoughts. And Professor Chung, as always, thank you very much for your insights.
Thank you.
Right. While vaccinations are key to returning to normality, COVID-19 prevention measures are equally as important in keeping the virus at bay. Thank you for watching.